Good morning, everybody.
Hello, Stephen. Hello.
Hi there, everyone,
Dr.
and
Ginsbeog.
all of you at home. Let's see if we've got numbers up. 13 of you, 14, going up all the time. So my name's Stephen Ginsbeog, and I'm the acting president of COTA New South Wales. And I'd like to acknowledge Joan Hughes, our immediate past president and now life member, who initiated these webinars, and I think they've been a great success. So today is COTA New South Wales webinar on men's health. It's a smaller group than usual, I think, but that might work in our favour because we want to make it very interactive. Today we're joined by the COTA New South Wales leadership team, Gary Jacobson and Marika Kontellis, our CEO, who both got extensive experience in health and community. We'll be asking questions, allowing you time to reflect and encouraging you to engage throughout the whole conversation. Everything starts with the conversation. And indeed, men's health, having the conversation. We're realizing more and more in health that one of the most powerful tools we have is the conversation. So I'd like to acknowledge First Nations that we meet today on Aboriginal land, always was and always will be. And today I acknowledge the Gadigal people of the Eora Nation. I'm speaking from Gamaragal land, and I pay my respect to elders past, present and emerging, and to any First Nations people who are here with us today. First Nations cultures have survived on this continent for over 80,000 years, and prior to 1788, people were in better health on this land than by most of today's indicators of health in 2023. One of the ways that enabled families and communities to thrive in life and indeed death were social structures based on self and mutual care and a sense of country from which current social choices for positive aging and addressing our ill health has much to learn. It's important to note that New South Wales has the largest First Nation population of any state in Australia, and also that mortality, that's death, and morbidity, that's illness, from most chronic diseases is statistically higher in First Nations people, not only in Australia indeed, but across the world. I prefer to focus on what is strong rather than what is wrong, but the facts are inescapable, and the difference between a First Nations person and their counterpart in Australia, the life expectancy can be as much as 10 years different statistically. I'd also like to pay my respect to the elders of all the many cultures that call New South Wales home. So, next slide, please. If any of the issues, can you hear that noise? That's a funny noise. Maybe it's the camera making that noise. If this webinar brings up any issues for you that are challenging, upsetting, disturbing, please make note of these support services. And they're good anyway. If you've got a mate who's suffering, having difficulties, always think of these contacts if you're not comfortable giving first aid, either mental first aid or physical first aid yourself. And of course, always remember that if in doubt, call an ambulance. So, what are your expectations from this session today? We've now got 26 people on, and I notice there's already 2 people in the chat. So I'm wondering, there's someone, Margaret Yates, sunny Port Macquarie, with sympathy for all those who were smashed by the storms. So just to let you know, we're monitoring the chat, and I think that most of you have been part of a COTA conversation previously, but for those who are participating for the first time, let me share a few things about COTA New South Wales. We are the peak organisation for people over 50. We're a policy and advocacy organisation, and we work with politicians, policymakers, service providers, and the media to make sure that older people are not only heard, but acted upon what their voices say. We also train and support a network of older people to provide independent information and guidance through a range of programs. The Older Men's New Ideas, Omni, the Community Speakers Program, and our new pop-up peer information hubs. Now, just in terms of the housekeeping, everyone except the presenters are on mute. You can't unmute, but you can contribute, as a couple of people already have. Someone's come in from Blacktown. You can contribute on the chat. Prefer you didn't use the Q&A, but put all of your questions in chat. And of course, you can speak back and forward to each other, which is part of the pleasure of the new technology. Now, this event is being recorded and will be available shortly on the YouTube channel, the COTA New South Wales YouTube channel, along with all our previous webinars. So, have we got anything coming in yet? No, no one's saying what their expectations were. The reason we're doing it on the 30th of November was so that we could ask the question to any of those who've noticed, if they're in Sydney, the moustache on the front of buses, that this, of course, has been Movember, which I think many more people now know what Movember is. It was started by a group in 2004, 2 men, meeting, of course, in a pub. And it's grown and grown and grown. It adopted the slogan, "Give prostate cancer a kick in the arse." But now it concentrates on all of men's health, physical and, most important, mental, because without this thing up here, you know, nothing would happen. And this thing up here, above the eyes, as I like to call it, it can be a major part of many of our physical problems. So it's also created the official tagline, this is Movember, changing the face of men's health. And they, of course, there's all this stuff about growing moustaches and the like. And I can't grow anything up here, as hard as I try. There's a question from Surendra Pratap, some information on assistance and government initiatives for older people. I think we'll take that offline and you know, fill your inbox with some information. There is always, of course, the COTA New South Wales website. But Abdul says, I can't see you or hear what you're saying. Now, is that so for others? We'll wait to see if we get a response. So we might come back to that question of what are your expectations? Oh, there's someone coming in. All working well. No, I can hear you, I can see and hear fine. So here's another question, Margaret Yates. To know what men's problems are, to know why they don't speak up, all this can help females to understand the man better, and it will help females speak up too, no doubt. Absolutely right, which is why we've got Marika here, keeping us on track, making sure we speak up. It is very interesting, and I think some of the Movember movement arose out of FOMO, fear of missing out. Women have their breast screening and they have their cervical smear tests, and of course they give birth, and there's a lot of attention to the women in the birthing process. Men are just starting to be allowed into the birthing room, or they are, but men came to the realization, oh, we can get a bit of attention too. We've got things that we can make prostate cancer day, or men's mental health day. So this is great. It's evolving. We've got a long way to go to catch up with women's awareness of their health. But Pete Newman, hi Pete. I think many men are not as proactive as they should be in respect of addressing their health. Absolutely, absolutely spot on. And of course, that's a good conversation to have with your mates. And we'll come to the issue of having mates to talk about this with a little bit later. So Marika, if you can bring up the next slide, we'll see where we're going next. So this is something else to start popping into the chat. I'll just get rid of the chat room. What are the top 10 causes of premature death in men in Australia? Now, there's no prizes, there's no hamper being handed out to the first one to get all 10 right. You can just even, whatever comes to mind. And you might indeed find one that's not in the statistics. That would be very interesting. My biology teacher in high school, he said, whenever you see a straight line in biology, they're lying to you. So some people would say, wherever you see statistics in medicine, they're also lying to you. So you might have greater insights into this than the experts. So come on in and see what you come up with. And women can contribute too, because I work in nursing homes, and sometimes at happy hour, it's 95% women sitting there. And I say, what did you do with your men? Of course, I have to be a bit woke and say, not assume that it's a binary situation, as it's called. And so, I think we also need to consider LGBTQI health and well-being. So we've got no answers at all. So the teacher's going to have to tell you what the answer is. Oh no, here we come. Margaret, bowel, prostate, heart, breast, skin, thrombosis, brain, hip replacement. Yes, very interesting. A couple of famous people have just died from the hip replacement. Cardiac arrest, strokes, prostate cancer, accident. Yep, smoking, blood pressure. Absolutely spot on. Coronary heart disease. Yep. Here's my little list. We're going to show the list in a moment. Okay. Let me give you a bit more time. Let's move to the answers. And there they are. Let me move my chat room out the way. So ischemic, that means shortness of blood, heart disease, dementia, and Alzheimer's disease. That is coming up to be the leading cause of death in Australia. Trachea and lung cancer, there's your smoking. cerebrovascular disease, that's strokes, usually. Chronic lower respiratory diseases, that's from the era when smoking was more the issue. Prostate cancer, which is where the Movember issue started. And we won't go into all the detail of these, but more broad suggestions. Blood and lymph cancers, including leukemia. Diabetes. Well, diabetes is a contributing factor to the ischemic heart disease, the dementia, and the cerebrovascular disease. So they're linked together. If you are overweight and have diabetes, it will increase your risk of most illnesses, including cancer. And there is a very easy way to assess what your risk is, which is just getting a tape measure, Googling it, round your belly button, and it will tell you what the safe range is. So it's, I did a few summers ago, I went on a beach with many of these tape measures. I'm looking to see if I've got one. Yes, I have. Excuse me. And we had hundreds of these tape measures, which of course you can't get anymore, but you don't need them because it's all online. And if any of you send an email to us saying, I can't find it, I'll make sure you get it. So you'll see up to 94 centimeters is the healthy range. 94 to 102 centimeters is the risk range. And then always in red, danger, danger. 102 centimeters around the belly button. Now, this is universal. There are some Asian populations, this is not reliable, but this is remarkably reliable. Did you know that an increased waistline increases your chances of developing chronic diseases, such as type 2 diabetes, heart disease, and some cancers? So, love some of the little things on the back. Messages. 2 plates of food. Swap big for small. Become a swapper today. Swap driving for a short walk. These are all the social determinants of all of these illnesses, whether it be, and we'll come to it later, loneliness or diet or lack of, we say, actually, I shouldn't use that word. What we eat. Let's not medicalize it and call it diet. What we eat and how much we move around. It's really very simple. We used to do it, which is that first slide I put on when I acknowledged First Nations people. So enough facts. Let's see what the next slide holds. So I think, Gary, this is where you come in.
I think that is correct, Dr. Ginsbeog.
You're definitely a man.
This is my big picture stuff. Thank you. Thank you. Thank you, Rick, and good morning, everybody. Yes, look, as Stephen has said, we'll try and move into a more of a conversational tone if we can, and please feel free to use the chat. As we look through really the bigger picture stuff, and I guess our focus on men's health is important because we are in somewhat of a crisis. The stats speak for themselves, as you can see. Men are dying earlier than women. We've always known that women have had longer longevity. It's been well noted, but that gap between males and females has actually increased. And the last dot point on there, I think, which is probably the thing that's troubling most of us men, not just people like myself that are nearing 60, but the increase from people 50 plus, males 50 plus dying by suicide is very significant. And that stat across the world, 1 man dies by suicide every minute of every day. Males accounting for 69% of all suicides is a staggering statistic. If you actually pare that back and work out what generation of men, in other words, what age gap between X and Y men are dying at the highest rate, it is actually older men. And that's sort of the 50 plus. We are not immune. It's not a young person's disease. That's often what's reported in the press. But the reality for all of us, and Stephen would know it, as a first responder, as a GP, unless we get to talk about these things, unless we get to share these stats. And it does start. November was a good example. Stephen asked, what did you do? A group of us early in November had run 30 kilometers at a 30% increase of gradient. And I actually had no knowledge of what that was until somebody said 30% increase is the increase in male suicides. I don't know the statistics if it's over the decade or over the, but it's been a 30% increase in male deaths by suicide. We did our little bit, but the statistics are very stark and very troubling, as is the ones above it. There's obviously a crisis that males have, and I think Margaret had asked the question in the chat, what is it that men, what is it that women do, what is it that men don't do, etc., and how can we help each other and how can we help ourselves? We'll cover that shortly, but as we move ahead, these are the things that we've done good things, men, as well. So let's not always be negative in all the troubling things. We generally do live a longer life. We're doing well. We don't smoke as much. Only 1 in 10 men smoke daily. So smoking was a real male issue and a real male problem for us. That's changed a lot. 27% of men maintain recommended physical activity. So we are getting more active. We are swapping our cars for our feet. And then the things that we are still lagging behind in, and these are the issues, I guess, that we are going to look at in some further detail, not all of these, but some of these throughout the chat. 1 in 4 of us are not overweight. That is a positive spin on it. With weight loss, men are far more conscious of their weight, but we still have a long way to go in addressing the issue of overweightness, if there's such a word, or obesity. Injuries are more common in men. Somebody mentioned that in the chat. I think when Stephen is asking the trivia, yes, men do die more from accidents, and that's not necessarily because there's more men in the world, and it's not necessarily all about risk-taking and different things that men do. There is a level of chivalry in the male genome, and we do take unnecessary risks or do things that women generally tend to not do. We still have shorter life expectancy, and as I said, there are more preventable things that we can do as men, mitigate those risks, and therefore increase, obviously, our longevity. We are 3 times more likely as women to die from suicide. We don't want to harp on that today. We're not going to talk extensively about those sorts of things, but we will touch on some of the things that we can do as a gender species, and also obviously in society to address some of those issues. We're more likely to drink, smoke, and use illicit drugs than we were some time ago. But when we talk about a health crisis, we're not necessarily talking about something that is uncontrollable. And I think the important thing with all these conversations that we're having, the majority of things are very much within our control. There's a lot of things that we can do simply. I think Stephen started it, and Marika, I'm sure, will share a lot more shortly. Having conversations, being there for each other, connecting with each other. Don't exercise alone if you can exercise in a group of people. You're ticking off 2 things there. You're not eating, you're exercising, you're talking, and you're in community. You get 4 strikes for the price of a 3-kilometer walk. It doesn't have to be physical. It doesn't have to be excessive. Males tend to do things at the extreme. Don't take that lead. Just do things within moderation. Swap a walk for, swap an elevator for a flight of stairs. All these things that we read, we tend to overlook at times. Don't. Just stop, read, and have a little think about what minor adaptation we can make to our lives. Talking is a really good one. Walking is another good one. I think we do go through a little bit more. Is the next one me, or is the next one not me? I'm not sure. But this is why we want to do what we do. We use if-then statements as a really powerful way for us to communicate what we're actually wanting to achieve, rather than simply talking and conversing. But if we actually were, systems were better, if we're informed and had a better understanding of the differing health needs, all the things that we read will actually be more effective, and we will live longer, healthier lives. There's no doubt about the fact that the messages are there. communication is there. Are we heeding them enough, and are we doing enough for ourselves and for our community as men? Probably not. And it's time for us to take some control over those things, because the stuff is there, and if we did do them, we would live longer and healthy lives, unquestionably. As we shift gear, and please use the chat again, this is a question that is an important component of why we're doing webinars such as today, and why we're wanting to engage. But Margaret had asked us earlier on in the chat in many ways, or you'd asked as an outcome for today to try and get a better understanding of why men's health and wellbeing outcomes are worse or different to women. There are some fundamental things that do answer that question. It's not just men being men. It is also about men being men. So we do have to understand the interplay between those two components. There's some things we can change more easily than others, but we can change, and we can address those things. We can heed messages more. We can talk more, and we can do a lot more to prevent some of the things that we know are imminently preventable, avoidable, and we can mitigate many of the factors that we have currently to date ignored, that contribute to the stats that I mentioned previously. I don't know if I'm supposed to be able to see the chat. Sorry, I'm not au fait with whether I'm responding, but are you able to, if you've got pondering a few minutes, if you can put some responses, what are your thoughts about it, particularly men? And I guess, Margaret, I know you had sought an answer. Let us know why you think the health and wellbeing things are different. We have mentioned some of it in the aforementioned text. Stephen shared plenty insights into that too, but there are significant differences, and there are things obviously that we can do. Stephen, I'm going to just ask if you're not on mute. Have you seen, as a GP, has men's attitudes towards their own health changed over the past 10 years?
Remarkably slowly.
Slowly.
Yeah. Young men, particularly, of course, and men in general tend not to share. Now, is the many theories for this. Was it because when in our upbringing we were encouraged to be strong and not to complain and be a sissy? Or is it that we're busy with our work? None of these explanations really account for it. They all contribute to that phenomenon,
right,
of not speaking up. I think generally as well, a cultural phenomenon is a loss of health literacy in general. That extends all the way through the life cycle to death literacy. And I think what's happened is that the doctors have become the repository of all health knowledge and all good sense around health. And so if you want to do something about something that ails you, the first place you think of is going to the doctor. Going to the doctor, of course, now is much more expensive. But even in the National Health Service that I worked in for many years, men tended not to present as much as women. You're muted, Gary.
Sorry. Thanks, mate. I might ask Marika the same question, who's obviously got extensive experience in the non-primary care setting, so sort of in community care and community health. Is there a change? Has there been any different?
Yeah, thanks, Gary, and good morning, everybody. I just want to, before I do answer that or begin to answer that question, just remind everybody We have raised some issues. If you feel uncomfortable or you feel that those issues have moved you in any way, remember to call Lifeline 13 11 14, 13 11 14. You know, I think there are some fundamental differences between men and women when it comes to help seeking. And I think certainly Pete Newman raised it in the chat earlier. I think Margaret raised it. Blokes have got this she'll be right, mate, particularly Aussie blokes. And they certainly have, you know, you've got to sort of toughen up kind of thing. The issue is, for many men, they present to the health system when there is a crisis, when the symptoms are just so overwhelming that, you know, it really has affected their well-being and, of course, has brought them close to death. The evidence says quite clearly, when we look at the evidence as to why those outcomes are so different for men and women, the first one is about this conformity to masculine beliefs. So, you know, Stephen, you hit it on the head. Others in the chat have also said, hit it on the head. Men are still less likely to seek professional help and care when they're going through an emotional, personal or health crisis. That's the fact. They're underrepresented in most healthcare settings. So they're not going. Doesn't mean they don't have symptoms. They're just not seeking help. Doesn't mean that they don't feel lonely or isolated, depressed or sad, anxious, or whatever. It's just that they're not presenting in the same way that women are presenting.
And as you're speaking, Marika, the thought just came through. I think men may have, or I think people in general have this feeling, and it's a good feeling too, that we are very strong, humans live a long time, and that it will heal itself. A sort of a very positive approach to illness, which shouldn't be lost in the, you know, us making people more fearful that major illness is just over the horizon. But many of the illnesses that we face do indeed heal themselves, or our bodies heal them. So never forget the other side of the neglect. Yeah.
Thanks, Stephen. Of course. But I guess we're talking about, you know, issues like high blood pressure. You know, you've had that for many, many years and not got it treated, you're more likely to have other issues because of that high blood pressure.
Yep, especially the hidden disease.
Yeah. The other interesting fact that people might also find interesting is that women globally frequently report and seek care for stress, depression, and anxiety. Men are not doing that. And I want to go back to Gary's sharing of statistics, particularly around, you know, poor mental health and in some cases suicide. Women experience lower earnings and face many other social inequalities. We know that right across the world, but they outlive men in all countries without exception, even where there is, you know, extreme inequalities. So something in that tells us there's a reason why seeking care and help is really important. And seeking care and help doesn't necessarily have to be through a doctor or it can be from a friend. We're going to talk a little bit about that in a moment. Lack of information and awareness. You know, sometimes people just don't know. They just think, you know, dizzy spells every time you get up is just, you know, you've got a bit of sun. So they ignore some of those symptoms because they don't have the information or awareness. Boys and men, according to the evidence, tend to underestimate risks, suppress emotions, and again, the evidence says they're more likely to be impulsive and sensation-seeking. In other words, blokes and boys take more frequent and more dangerous risks. Oh yeah, I can jump into that water. That's no problem. And I think that certainly plays out in the workplace. Men are in riskier jobs. And 9 out of 10 people who die in a workplace accident are actually men. So again, there are reasons why men's outcomes are different or worse than women. Stephen?
Yeah, I was just going to add, because we were talking about smoking, alcohol and drugs, and particularly in the over 50 population, we are seeing quite a marked increase in population-wise the use of alcohol, illicit drugs, less so smoking. Now, they add to that risk, whether it be in driving or falls or anything that we do. It will increase our risk, for example, of mental health issues. Whether this is something to do with the baby boomers coming of age, the older age, we don't know. That would be a good link, of course. But these risks that men have been used to taking all their lives that you've named, will all be worse with drugs and alcohol. And I don't think people realize that our ability to hold our drink, as it were, is not as good as it was when we were younger.
Yeah, thanks, Stephen. And of course, you're absolutely right, because when we looked at the evidence, substance abuse is the other key reason why men's outcomes are different or worse than women's. Absolutely every day of the week. Can I just pause there and also acknowledge that there has been a little bit of chat going on. Margaret, thank you for sharing that. I'm so sorry to hear about your husband. I realise it was a decade ago, but again, a real example around a man not seeking help when he needed it. So again, thank you, Margaret, for sharing that online. The other really important issue and difference is that, and Stephen, you might be able to explain this a little bit better, is that female bodies are known to produce a stronger immune response and larger amounts of antibodies compared to the blokes. And they say that this helps possibly ward off diseases and helps women live longer. We kind of saw how that played out with COVID as well, in terms of the number of deaths. We know that older people were more likely to die because of COVID, but we also knew, according to the evidence, that men were also more likely to die because of COVID-related illnesses. So again,
yeah, absolutely. I think, of course, as the biology speaks and survival of the race speaks as well, women have to carry the babies, so they have to be strong. Men just do this incidental performance, providing some sperm. Of course, you have to be fit to provide good sperm, but women have to carry babies, and in other cultures and times, many babies. So perhaps there's an innate strength there, and then the role of the grandmother after menopause is to have been freed of childbearing, but needs the strength to continue to care for, as women mainly do biologically, care for the grandchildren or the great-grandchildren. We see this happening as a important social factor in our culture.
Indeed. And I think this next bit of evidence too is, the biology is a factor. So thanks, Stephen. You've done this before.
Biology.
I think you know a little bit about it. Indeed.
Biology, yes. I had a great biology teacher.
Yeah. So I think again, the fact that the female sex hormone of estrogen is protective of cardiovascular disease. And they say the evidence is partly responsible for the lower incidence of those kind of diseases up until, menopause. Once you hit menopause, us ladies too also have that risk. The male
you do stay strong.
Yes, that's right. Okay. The male sex hormone is also, testosterone is also high, and that is associated with disease. Again, this is where the evidence is saying is why men's health outcomes poor. So Stephen and Gary talked about the global stats around men dying earlier than women, much more likely to die by suicide, whole range of other factors. This whole Movember movement is all about shining a light on the disparities between men and women's health. These are the reasons. But fundamentally, the other evidence that is coming out thick and strong is a lack of social connection and ageism. I'm going to talk a little bit about that in a second. As I pause, though, you've heard this. Are there any comments or insights? Has anything surprised you out of what we've shared so far? Please use the chat. Anything surprising?
Well, we haven't driven anyone away because there's still 29 people on the participants. That's a good sign.
That's good. Anyone surprised with anything we've said? And I've learned something new on this COTA, on this webinar. You can put your hand up and I can press a button, and instead of using the chat, you can talk. Does anybody want to give that a go? Put your hand up. Do you know how to raise your hand?
It's down there on the bottom, raise hand. It's between record and apps towards the...
Someone raises a hand. You can still use the chat if you like. Has anything surprised you? Anything resonated with you? Anything that you've heard today that you want to just pause and have a little chat about? Thanks, Margaret. Maybe older men should, when having their flu jab, get some estrogen as well and stay clear of the walnuts and almonds. Ha ha. Nothing here surprising. It all accords with observations around. Thanks, John. Thanks, John. And I guess whilst you're still thinking, and John, thank you for saying that, because, yeah, it's not surprising. It kind of is. We know it. We know the reasons why. I'll come to you in a second, Pete. Keep your hand up. We can, thank you. We know the reasons why. But what do we need to do what do we need to do about it? We're going to talk a little bit about that. Pete, I'm going to see if this is going to work. I'm going to press the allow to talk button. There you go, Pete.
You'll have to unmute, Pete.
Yep, I've asked you to unmute. Oh, yes.
Yep.
I took my wife to lunch last week for her birthday down at the local RSL club, and we were sitting in the dining room, and I was actually quite amazed. I went to the bathroom through the bar, and it was really disturbing to see a lot of guys just sitting there on their own, and I was amazed at the number of those chaps that were there. And I guess Deb and I were there for an hour or two, and it just seemed like a really sad way to be spending the day. And I just wondered whether or not these guys would appreciate an opportunity to do things a little differently.
Thanks, Pete. And well observed, and it's one of the key issues that we as an organisation want to begin to tackle. This loneliness, isolation, loss of purpose, loss of skill to be able to integrate into your community and play an active role, something we really want to tackle. I'm also delighted that we were able to use this little function with Zoom. It's great when you find out a new thing. So thank you for sharing that.
I think there's a couple of things, to add to that very accurate observation. One is that men probably statistically don't cook as much during their adult years. And so when their partner may die, they have to have a solid meal down at the Ari or something of that nature. It is also a reaching out. I think they might not. I think they probably realise it, if only to see other people, and that, of course, has benefits. At least you're in somewhere with other people rather than sitting at home with a Vegemite sandwich or a boiled egg. I know my father dreaded my mother dying before he did. He would speak about it. He said, because I had no idea how I would survive, what I would eat.
Yeah. Thanks, Stephen. Yep. And it's an issue. It's why we also have the Older Men New Ideas group within the COTA network. There is much to do. Pete, you still have your hand up. I'm not sure if you wanted to add anything or it's just still up. Thanks to everyone for contributing. Thanks, Pete. I'm just going to tackle this little bit here. One of the other reasons, one of the key barriers to aging well for men, but also for women, in fact, for everyone, is this thing of gerontophobia, basically, which is a fear of aging, but it means and plays out negative messaging about aging in the media, age-based prejudice in the workplace, pressure from the anti-aging beauty industry, just use this miraculous cream and you'll look 30 years younger. And of course, the personal experiences of many older people. Older people also have a branding issue, and we're all guilty of playing that brand out, saying, oh, look, I'm too old, or I can't move like that. What do you expect? I can't get off the floor. Whatever we tend to say, it actually plays into this whole concept of ageism. I'm going to ask Gary to maybe share a little bit about this and ageism, and certainly our work in working with employers, Gary. But the evidence certainly suggests that ageism is one of the key factors, key barriers to aging well for older people.
Yeah, no, thank you, Marika. It's absolutely correct. The work we're doing in ageism, which is quite extensive at the minute, to try and address some of the barriers that we call mature workers, older people face in the workplace, has indicated that there's an absolute link between health and ageism. There's a direct link between how much money you have in your super fund, literally, and health determinants. So there are some real problems that we are facing, and I think gerontophobia, I think, is the expression Marika just shared with you, the definition, I should say, she just shared with you, is a big one, because in the workplace, there's a double effect for men. We tend to use more frequently, generally we as in the community tends to use those sorts of things like, oh, well, hang on, I've just got to get my glasses. We actually make light-hearted comments frequently about issues like that, that then becomes quite used in the workplace. We don't realize that we're doing it. We don't make those jokes about anything else in the workplace anymore. We certainly do about age. And men tend, again, research tends to indicate men do it more often than females. And if you add the third vehicle onto that, that men have a much higher requirement for our health based on work. We have less external pursuits than women, so we tend to focus, get a lot of our esteem, get a lot of our self-confidence from the work environment. If you add all of those things in and then make it, the difficult thing around leaving work, or unfortunately sometimes work stopping for you when you don't want it to, you've been made redundant, your job's gone, the world crashes down on men very, very quickly. But it does start with us often making very light of the things, I can't see, I don't understand social media, whiff waff or waff wham, it's called TikTok, and we make jokes like that. And as I said, it's very insidious, but it becomes very much creates the divide and actually adds to ageism. And we need to be very, not being wokey and being, stuff around it. We just need to be very clear what message that gives to others about condoning ageism and using those tags. So it is a real issue, as Marika mentioned earlier, trying to address it, certainly COTA's perspective, addressing ageism in the workplace and addressing loneliness. Bit of a combination effect of both of those is key, and it starts with us just being aware of exactly these things. You're a bed blocker, you're past it. Disparaging comments made to us as older people, older men, women, it's irrelevant at this point, are accentuated when we do it ourselves. And that's what we've got to try and curtail. Let's not do it ourselves. Makes it less condoning for others to do it to you. So yes, as Marika said, that is very clear, and again, reversible, avoidable, and controllable.
Stephen, I'm going to let you talk a little bit about this loss of purpose. I know I've heard you speak many times publicly and even at public health conferences about the importance of having absolute purpose, no matter what age we are.
Yes, well, let me say that, as an organization, we're known as a not-for-profit, which is an old label. And how not-for-profit organizations are now referred to is organizations with purpose. So let's hope that we follow that message through as an organization, COTA New South Wales. Men particularly have their identities very strongly connected with the jobs that they've done through their lives. Work and the workplace is essential. It's the backbone of their emotional well-being. And so as we age and maybe retire and are less welcome in the workforce, and indeed if your work in life has been physical labor, the body will prevent you from continuing to work past a certain age. Retraining, all of those sorts of mitigation strategies, of course, are very, very important. And we should always consider that we're never too old to contribute, which goes now straight into that wonderful quote from Simone de Beauvoir. There's always something we can do. We might think it's not important or that's not good enough. Again, playing into a lower sense of self. And I think it connects also to our strategy as an organization, which is to try and bring people into connecting with each other and realizing that if you're even having a cup of tea, or particularly having a cup of tea with someone, can be extraordinarily important in preventing, and this is a really big leap, chronic disease. It's chronic disease that affects men so strongly, and women too. It's crippling the health system. And to some degree, there is a social solution. You may remember from the opening slide of the intergenerational meeting of Aboriginal men, women, and children. Connection to do things with each other, not necessarily for the other person, but with the other person, is very important. And that word indignation, you know, I've read this quote before, but adding in indignation, so bitterness, it has to be named. So we were much happier to name love, friendship, but naming indignation and what a bad serve life has given us, and now how useless we are, is so important to have that conversation with others. It's life-saving. We know peer-to-peer conversations are one of the most powerful tools now available to us in the mental health crisis, as they like to call it. So John Desmond's coming in here a couple of times. Then more publicity needed for activities by older people. The most important, inspiring report recently was about the 97-year-old arrested at the blockade at the port of Newcastle. Great work, indeed. Social, political. It's not for everyone, but, you know, going over even to that man sitting on his own at the pub and saying, come and join us. That's both beneficial to the person asking the man in the pub, why don't you come over and join us? Or would you like to come over and join us? Of course, I might say no. But it's also beneficial to man. So it's mutuality. It's mutuality. It's so important.
So that loss of purpose also often is linked to grief and loss as one of the key reasons why people don't age well. And the reality is that for all of us, aging creates these unique challenges, particularly around loneliness and isolation. No one wants to admit they're lonely or isolated, and you can be around people and still feel lonely and isolated. There was a project called the Loneliness Project. It was a large-scale, very long, surveying, deep dive into how older people experience loneliness and what it means for them. What was fundamental is that out of the thousands of people that participated in that research, nearly all of them reported a feeling of sort of this deep-rooted sense of isolation as a result of losing those key connections. Now, that could be the result of losing a loved one, a best mate, a friend. Sometimes it's a pet. My father turns 88 today, and I said to him last week, Dad, you know, that's really great. He goes, yeah. He goes, it is. He said, but, you know, I kind of sit here. I've lost my 7 brothers. He was very, very, very close to his brothers. His 3 best friends. And now I go to a shopping centre yearning for connection at the local cafe, something I thought I would never have to do in my life. And it was the first time he shared that immense loss. Of course, we knew that that's what he felt, but he's lost all the important men in his life. And he feels like he's alone, and he's trying to replace those connections, but for him, and he said, they're irreplaceable. And that is a significant issue, not only for my dad, but for many people, men and women. As we age, this loss, this feeling of loss, can really overwhelm our day-to-day and, of course, our well-being.
While you've got that grief and loss slide up, again, statistics, damned lies, but sometimes they're helpful. Grief and loss have been again medicalized into something where you need a grief counselor, or you need to go and see the psychologist or the psychiatrist. Now, there are a few situations where that might be necessary, but the evidence is very strong that the group of people who are most sought out to alleviate feelings of grief and loss are people who are close to you or peers. And indeed, they have the best outcomes in journeying what are normal human emotions. They are not illness. And another part of grief and loss that I think many of us who are aging have is called anticipatory grief. So we're already imagining how griefful we are going to be, and indeed how fearful we are of death. And the solution, as always, or one of the solutions, as always, is to have the conversation with someone else and share. And it has huge proven therapeutic, there's a lovely word, therapeutic benefit. It's one of the little phrases we use. So thanks for bringing that grief and loss slide up, Marika.
That's okay. Rose, thank you for your comment here in the chat. That you found men are often really reluctant to take advice, especially from us women. I think how we give that advice is really also something we might need to revisit as women. Older men are also most likely to hold on to old-fashioned ideas, whatever they are, about gender roles. You're right. It does play into that. Thank you for sharing again that you lost your important people, your husband, and your father and your brother sooner than necessary. Again, it's that grief and loss, the loss of a loved one, the times in our lives where we have to stop and reflect. All those things are part of life's journey. And I think Stephen, as a medical doctor, says you need to really turn to those close to you and keep those close to you for support and advice. You don't need a doctor to tell them, look, I'm feeling really, really sad today. Often you need a friend. And you're right, Pete, new friends require time, patience, and the nerve to develop that intimacy with the old friends. You can't kind of replace it. And I think that's what my dad was saying. I'll never have what I had with my brothers. They were absolutely inseparable. And he's right. But he needs to invest time into new friendships. There's no doubt.
Marika was and always will be a social worker. She works in a social fashion. There we go. Social connection matters.
Great segue.
One of the techniques for when someone is lonely or is needing someone, perhaps with aging, needs someone to help them, and say, "I've got no one in my life. They've all moved away, or it can be of no help," is to sit down with the old yellowing address book. Now made harder because it'll all probably be on the phone, but I think many of us older people still keep the old address book. And what a delight it is when you make the phone call to someone you haven't spoken to in many, many years. And you have a chat. I mean, that's one of the advantages. And if you have a phone that can do WhatsApp or FaceTime, you can use the technology to reconnect. And I've had many, many experiences of when someone does that and they say, you know, they've moved back and they're just in the suburb down the road.
Yeah.
This social connection matters. And I think all we older people really need to think, who are the 5, or that's the minimum number, I think, who are the 5 people who are going to have our back as we age?
And, you know,
what we're going to need them for.
Yeah, indeed. And I think, Stephen, you know, when I think back, the work I've done in community over the years has all been around community development and connection, irrespective of where people are, whether they live in country, rural, small towns, urban, coastal towns, bush towns. The importance of connection and community comes through. And as a social worker, we've been talking about it for decades. And it's been probably the last 5 years where the research has been so compelling that, in fact, this stuff works much better than a pill. That social connection is the blockbuster drug or solution to so many of the problems that we're seeing, not only in men's health, and I don't want to take away what we're talking about today, which is a focus on the importance of men's health matters, but right across the health of communities. This State of the Nation report around social connection in Australia, released this year by the Ending Loneliness Coalition, that geared up to the first ever Loneliness Awareness Week in Australia, really is quite compelling. It shows all the evidence, brings it all into one space and saying people are dying yet earlier than they should. The impact on the health system is really significant. People are unhappy, living unproductive lives because they are missing the connection. There is an irony in all that. We are living in a time where our connectivity has been unparalleled to any other generation. We can, you know, Zoom with people anywhere in the world. We can talk online. We've got fancy schmancy mobile phones. Connection should be easier, right? But it's not. And I think, and particularly for specific groups, and today we're talking about men, specifically for men, you know, we have a lot of work to do. Stephen, the evidence again around the health impacts of a loss of connection, particularly for men, are pretty astounding.
They are indeed astounding, and the evidence grows and grows and grows. Social integration has a stronger. You probably heard, you know, social connection has more benefits for health and chronic disease than giving up smoking 15 cigarettes. You'll see a flu vaccine in there. Now, this is in no way to say, oh, well, flu vaccines aren't important. And I must just get a plug in here for the fact that shingles vaccine is now, it's a new vaccine, except it's a very old vaccine. It's much more expensive than the old vaccine, but it has just come into the free list and you can get it at the chemist or most chemists. Of course, there's a delay because it just came in a couple of days ago as a free vaccination, and all people over 70 now can receive the 2 vaccines. They used to be $250 each, which really excluded most people. It's a much better vaccine than the previous one. So keep your COVID vaccines up to date. keep your flu vaccines up to date, do your cardiac rehab, do your exercise, lose weight, keep an eye on your blood pressure. But number one, social integration. I often say that a cup of tea with someone can be more helpful. A hot drink can be more helpful than a hotline. So health is moving a lot into hotlines. Phone up and get some advice. And of course, the Lifeline is a very important hotline. But a hot drink with someone, or as I said before, finding 5 people who've got your back and who you might share a meal with or whatever, and talk about connection. So important. Here's the evidence. Marika, you're great how you found these slides. I looked for them the other day.
Yeah. Look, I think again, we're one of your expectations as a group today was to know more about the facts. Here they are. The facts really, really clear. If you've got mates, you'll live a longer, better life. But I really like Pete Newman's comment in the chat that, it takes time, patience and nerve to develop the intimacy shared with old friends and lost friends. Yeah, it does. You have to invest. And we're not very good at necessarily investing in those new relationships. And the evidence says men aren't. So Margaret's question is, how can us women help men do that better? Well, I'm not quite sure. There's a number of answers to that. And again, one of the things we are doing as an organisation is building this network of older men, new ideas, where we're really wanting men to come together in their local neighbourhoods and, form their friendships, form their mateship, and contribute to the community, their purpose, as best and as they want. And I know that we'll be sending more information around our Omni network. We're particularly interested in starting that network on the Central Coast. The time is now. The time is now.
Daryl Green's made a chat,
Yeah.
and absolutely, that's a great model. Always important to think, who can I go out to as well? And I'm sure those 200 blokes, people said, why don't you come down and join our golf group? It's reaching out that's so important.
Yeah. But can you play golf well, Daryl? That's irrelevant, isn't it? I think
it's always the 19th hole.
Yeah, indeed. 1 in 4 men, the evidence tell us they haven't got a good mate. 1 in 3 experience the loneliness. Having no mates is as unhealthy as 15 smokes a day. Again, Stephen confirms that. Yes, Daryl, totally not important. Kim, you have your hand up. Would you like me to, if I can, get you to use your voice? If I know how to do this again, I'm not sure if I do. I'm trying.
What's really exciting is that we've had 29 participants all the way. Now we've got 30. So obviously the word is going around.
Kim, I'm gonna just press the button here, and you're going to be able to talk, I think.
Yep.
Hello, Kim. Can we hear you?
Come off mute, Kim.
Yeah, you do need to unmute.
And the unmuter is all the way on the left, on the bottom. Well done for getting the hand up. That's
good. That's good. You can.
That's good.
Yeah. We've lowered your hand. Maybe that was an accident. It's all good. If anybody else wants to have a chat, just please put your hand up. Having no mates is bad for your heart. Look, we can't keep going round and round and saying the same things. I think we kind of got this message in this in this webinar anyway, the importance of social connection is absolutely evidence-based. It is not just made up and a nice thing. It has significant positive health benefits for people. We know that if you stay well and you stay connected, you will continue to find your purpose, and you will absolutely play your role in the communities that you live in and work in and participate in as you like, as you want. We here at COTA New South Wales are absolutely sure that the answer is in community. We have begun to ask the critical question: what if people of all ages did not experience barriers to participating in their community? What if communities recognised and encouraged people to design their own ageing well systems? Daryl's system is 200 blokes playing golf. That is an ageing well system and support. It's actually evidence that will work. And what if people stop being afraid of aging, which is, Stephen's message? You can't beat it, but kind of go with the flow with it and have the conversation around the importance of aging. If we were able to do these things, then we would all, and particularly men, be able to age well and have good health outcomes. Dennis, I notice you've got your hand up. I'm going to press a button, I hope, that will allow you to use your voice, if I can find it down here.
While you're doing that, Marika, I'm just going to come in with another fact that reducing loneliness can have up to 50% effect in reducing dementia and its symptoms, 30% in all of those diseases that we saw, cardiovascular, heart disease, kidney disease, respiratory chronic pulmonary disorders. Now, if there was a pill for that, we'd be hearing all about it. And of course, it would be costing a fortune, an absolute fortune. And this is why health is costing more and more, because instead of addressing loneliness, we're sending people to hospital, or we're inventing new drugs. So the answer, we need all of those, but we can reduce the incidence of all of those chronic diseases which you read about in the newspaper by ending loneliness.
Indeed. Dennis, I think you've got a voice.
Yep, I think so. Let me introduce myself. Firstly, I'm the president of the Network New South Wales for U3A.
Right.
And one of the things, of course, I've been hearing constantly through this session, and the reason I joined it, was to learn a little bit about COTA's approach. And of course, U3A, which is a not-for-profit association. Stephen, are you aware of U3A?
Yep, absolutely.
Right. Well, there are 5,000 members in Sydney alone. We have 64 U3As in New South Wales and growing. And all of those things, I've just run down a quick list of benefits. Combats loneliness, isolation, both geographic and social. I won't go through the whole lot, but that says what you've been saying. Get involved in something. We had 100,000 people throughout Australia. In New South Wales alone, participation works at 877 days in a calendar year. There's no other organisation for seniors that does that sort of participation rate. And we find it hard to communicate with people and tell them about us simply because we're a not-for-profit and we don't have the money. I've had a meeting with the Minister for Seniors, who didn't have a clue who we were. And I asked, could we have some editorial in seniors on the Seniors Card newsletter? Seniors Card newsletter is all about paying. Hence, we can't afford it. So that our biggest problem is the communication, and that's your biggest problem as well. How do we?
Sorry to interrupt you.
Well,
I think University of the Third Age, so people might not know U3A, is such a critical organisation, and I know that a lot of our members are also members of U3A, and I know that a lot of what you do is about social connection, education, awareness, etc. We should. Can I suggest we talk offline?
Oh no, I was going to suggest the same thing.
Good. Well, we're on the same wavelength.
In fact, I've been planning to arrange a meeting with you ever since you were appointed, and I live in Berry, and I've had a few problems, and I've not been able to get up to Sydney.
Excellent. Well, it's a date. I'm going to chase you at the end of this session, if that's okay.
No, that's fine. Yep.
That's terrific. That is really terrific.
Dennis, this is an example of connection, isn't it?
Absolutely.
Look at what the potential growth out of this may be. So thank you so much for well, I mean, I'm sure you have no trouble finding your voice like many people do, but it's this thing of finding our voice. And it's great Marika found the button to press that gave our audience the voice. And in future webinars, we'll use that more.
Indeed, indeed. I am really conscious of the time because it's a conversation that, you know, we could probably spend another couple of hours on. The answer is clearly about connection. And before we go to this little video, in the 1940s, no, sorry, don't go there yet. Is again, Kim, I can see that you've raised your hand. I'm going to unmute you. You're now on. You have to unmute yourself. Kim?
What I want to say is there is a senior club called Probus, and you don't have to play golf. It's all sorts of outings, activities, cinemas, and it's a monthly meeting. And I think for people to connect, it's a very interesting way because it's not restricted to any activities at all. The meeting is about 2 hours and it's monthly.
Thank you, Kim. And this is Probus, you said?
Yes, Probus.
Yep. And there are many Probus organisations across. So we've got Darrell's Golf Club, we've got University of the Third Age, we've heard about Probus. There's Rotary clubs, there's your local golf, there's your RSL, there's your knitting club, there's your men's sheds. There are, of course, our COTA New South Wales Omni groups. There is so much in community to get involved when we're talking about men's health, particularly as we have been today. It's how do we encourage and support men to take that first step to reach out. And the first thing is we need to talk about it and raise awareness. And that is why we had this session today. That is why you asked for us to talk about men's health and to continue to keep talking about it as we head into 2024. I'm going to share this very quick video before I hand back to Stephen to wrap up.
An anomaly in America. No one under 55 had died of a heart attack or showed any signs of heart disease. The local death rate for men over 65 was half the national average. A team of researchers led by Dr. Stuart Wolfe considered whether this was because of their diet, location, family history, or exercise habits, but on the surface, nothing was different from the rest of America. In fact, the town was made up of Italian immigrants who worked in quarries and factories, smoked unfiltered cigars, and had dinner tables laden with rich Italian food. Rosettans of the 1960s still held on to their old world ways. It was normal to find 3 generations under the same roof. 80% of men in the town were members of at least one community group. They would gather in each other's kitchens, play cards, and simply talk. The conclusion? Rosettans were nourished by each other. Over the next decade, the multi-generational homes broke up, and by 1971, when opulent houses, expensive cars and swimming pools appeared, the first person under the age of 55 died of a heart attack. By the 1980s, the rate of fatal or showed any signs of heart disease. The local death rate for men over 65 was half the national average. A team of researchers led by Dr. Stuart Wolfe considered whether this was because of their diet, location, family history, or exercise habits, but on the surface, nothing was different from the rest of America. In fact, the town was made up of Italian immigrants who worked in quarries and factories,
It's good to get the message a couple of times.
Roof.
Yes.
80% of
Apologies
men in
about
the
that.
town were members of at least one community group. They would get
The message is clear.
of a heart attack. By the 1980s, the rate of fatal heart attacks in Roseto was the same as the rest of the country.
Okay, well, you know what? That little bit of technical thing didn't work so well, so I appreciate your patience, but we'll share that to everybody that was here. It's a fantastic little video and a fantastic story, Stephen.
Yes, well, in that respect, and I think of importance to connection to everything we've said, if you are looking something up on the web, go to any site that is called Compassionate Communities. This is where cities around the world and individual communities are getting together to share the experience of life and death. So it's a whole other webinar which we'll be bringing to you on compassionate communities. It is what it says, doing with people, being compassionate, and being a community. It's not a pipe dream. It's not a fantasy. It's not something that we can't recreate or reanimate in our culture. So that brings us to the end of today's webinar. We're out of time. Much more to talk about. Please let us know if you have any ideas that you would like us to run a webinar on. There'll be an email going out to you shortly, which will include some extra information and resources, as well as a link to the COTA YouTube channel, so you can share today's webinar with families and friends. If each of you shared it with those 5 people who we were talking about, just think of how we would magnify the reach of this message. Stay tuned to hear about our next webinar after the holiday break in February 24. Have a great holiday break, however you celebrate it. And thank you so much for joining us. I hope you've enjoyed the discussion and either been reassured that what you've known always is shared by others, or maybe some new things. So great to have you along, and see you next year.
Thank you from me too. Thanks, everyone.
Thanks, everyone. All the very best.